Now we get to look at another set of disease conditions. Okay, another set of disease conditions, and this is what is known as seronegative what spondyloarthropathy. Okay, seronegative spondyloarthropathies. So for what we have here, they are as follows. So you see different types, right? So they're actually a group of chronic inflammatory rheumatic diseases, and they share some common clinical, genetic issues or radiological features. Do you understand? That's why we actually put them together. So they are called seronegative because they typically lack that rheumatoid factor that is usually found in rheumatic diseases, you know. So seronegativity, there's absence of rheumatoid factor. Axial involvement, they usually affect the spine, the sacroiliac joints. Okay, enthesitis, you know, the inflammation of the tendon and the, you know, ligament. So peripheral arthritis, there's usually asymmetric oligoarticular. So extra articular features is there's uveitis, there's psoriasis, there's inflammatory bowel disease, and it's usually strongly linked with what? The HLA B27. So major types include Ankylosing spondylitis, which leads to spinal stiffness, giving you a bamboo spine. This is Ankylosing spondylitis. Okay. Then we have reactive arthritis, also known as a Rheumatoid syndrome. Okay. Arthritis following infections. We are having arthritis, uveitis, and conjunctivitis. Then we have psoriatic arthritis. Okay. Occurs in patients with psoriasis. So we have nail changes like pitting, oncolysis are common clues. Then enteropathic arthritis include association with what? Inflammatory bowel disease. Okay. So clinical clues, it usually affects young people that are less than 40, and there's a lot of back pains, and when you wake up in the morning, there's a lot of stiffness. Why? Because you have slept all through the night and you haven't exercised that joint, so to say, move around. So alternating buttock pain suggests that there's now involvement of the sacroiliac joint, that's sacroilitis. So radiological features was sacroilitis, you know, you see inflammation of the sacroiliac joints, you know, the desmophytes, so obtained vertical bridges between the vertebrae, bamboo spine, and peripheral erosions.